So, yesterday, this happens. And the reason that I'm going to explain the situation to you is because I want to help educate the general public about why hygienists do things that they do. It's not to bother you. It's so that we can be the best caregivers to you. So, patient comes in and I ask if anything's bothering him, and he says, yep, I've got a bad tooth here. And I'm asking about symptoms. Is it a sharp pain, dull pain? Does it hurt to hot and cold when you chew on it, etc.? So he gives me an explanation, and I say, well, we need to take an x-ray to figure out what's going on. He says, no, I don't want x-rays. And I said, I know you don't want them. We're gonna keep it to a minimum, but an x-ray is a very valuable way, and sometimes the only way that we can narrow down exactly which tooth is bothering you and exactly what's going on. Is it decay, is it a fracture, is it infection? He says, fine, just one. I go gather my belongings, I bring them back, I take an image. I realize he has a wisdom tooth, so there's 3 very big teeth back there. I don't suspect that it's the one that's been treated with the root canal. I don't suspect that it's the one in front, but it looks like something might be going on with the wisdom tooth. I can't see the whole thing in one shot, so I explain, listen, you've got a wisdom tooth that's placed way back in your jaw. I need to take an x-ray of that one also. And he says, you couldn't get it in one shot? No, sir, I couldn't. The sensor is this big, so it usually, this is the space that it covers. I want to make sure that I can see the entire wisdom tooth so I can tell you exactly what's going on with it. It looks suspect. Fine. But that's all I'm doing, he says. Fair enough. So then I thought he was concerned for my safety because he asked me where I was when I was taking the x-ray, and I said, oh, I'm around the corner behind this wall. And I like to make people feel a little bit better. I said, don't be concerned though. I said, the x-rays that I just took on you are equivalent to about a banana, or maybe a banana and a half. And he says, what? And I said, yeah, there's a lot of foods that are radioactive, basically. And he goes, you don't get radiation exposure from food. You get radiation exposure from taking x-rays. And I said, that's not entirely a true statement. I said there's a lot of self-induced things that we do, and there's a lot of natural sources of radiation, environmental exposure, stuff coming out of the ground, from the sun, out of concrete, being next to other people, smoke detectors, foods that we eat, foods that have potassium that break down that are actually radioactive. And I said, I've actually got a very interesting chart that gives you all the comparisons of all the sources of radiation in our life. And it's just to make people feel better. And he says, I'm not interested. I said, okay, I'm gonna put my stuff away. I'll be right back. So I came back, I'm doing an assessment on this tooth, and I'm explaining the possible outcomes. I am not allowed in Florida to diagnose the situation, but clearly I can see what's going on, and I say something to the effect of, the doctor may advise you to have this tooth taken out because of blah, blah, blah. He says, you know what, just clean my teeth. Yes, sir, I'll do just that. I clean his teeth, we have some chit chat, the doctor comes in and explains that the tooth is really far gone and we're gonna need to take it out. So, this is a public service announcement. Let your hygienist do what they need to do to take really good care of you, because that's really, in essence, that's it. We're just trying to do our jobs. We take x-rays so that we can help diagnose situations. And I also want to let everybody know that the digital x-rays are very low doses of radiation. And I have a chart if anybody wants to see it. It's very cool. It talks about chest x-rays versus traveling on an airplane or going through an airport security, or foods that we eat. And yes, foods that have potassium that break down are actually slightly radioactive. So there's my rant. There's your public service announcement. Everybody be nice to one another, all right? We don't like to have teeth taken out, and if you let us take our x-rays on a regular basis, we can probably stay ahead of some of these major problems, catch things when they're early. So enjoy. It's my Friday in the clinical realm, so I'm gonna be doing some other stuff today with burst and with plaque HD. And so if you guys have any questions or concerns, always feel free to ask, as long as you're nice about it. Enjoy.